Thank you for not smoking. We as consumers have the right, whether or not, to eat at an establishment or to shop at places where our food or our products have not been handled by smokers. I am here today to persuade you that employers should be able to discriminate against smokers by asking them beforehand in a job application or in a job interview if they are a smoker. I plan on persuading you by using these three main points. My first main point is the outrageous cost of healthcare to our employers to employ or to insure a smoker. My second main point is productivity. Productivity is lower and absenteeism is higher with a smoker than with a non-smoker. And my third main point is that non-smokers are still being exposed to secondhand smoke in the workplace. So that brings me to my main point number one. My first main point is the expanding cost of healthcare. According to a 2009 CDC report, it shows that an employer, a self-insured employer, pays an extra $2,016 for healthcare coverage for a smoker. And according to an Ohio study headed by Micah Beeman, who is an assistant professor of health services management and policy, that shows that it's an estimated that it costs employer an average amount of $5,860 to employ a smoker. $5,816. How, you ask? Well, that brings me to my main point number two. Main point number two, and contributing to that $5,816 is loss of productivity, higher absenteeism, presenteeism, and short-term illness. Presenteeism is when a smoker is present, but they have lack of productivity. And this could be due to toll of chronic illness or worried about smoke breaks due to their nicotine addiction, and so on and so forth. Productivity is down largely due to lower than average performance rate and longer smoke breaks. And this is according to Dr. Lundberg, who is the economist at the Free University of Amsterdam, and also according to a biotechnology report, it is estimated that smokers take 2.3 times more absent days than non-smokers. So let's look at my main point number three. Main point number three is that non-smokers are still being exposed to secondhand smoke in the workplace. According to the 2013-2014 study from the CDC, it showed that the 20% of non-smokers were being exposed to secondhand smoke. And according to Dr. Luckhart, who is a medical officer for the CDC, it shows that secondhand smoke is one of the top occupational hazards. And it is estimated that 41,000 deaths are contributed to secondhand smoke. This is not acceptable. But let's look at the opposing viewpoint. The opposing viewpoint is it fair to smokers to discriminate against their chosen activity? Well, it is true, not every smoker is the same. That is very true. But is it fair to our employers to have to take on employees that cost so much more in healthcare and has lower productivity that they didn't ask for? After all, smokers chose to smoke. And with that comes the responsibility of smoking. So let's recap. I am here today to persuade you that employers should be able to discriminate against smokers by asking them beforehand in a job interview or on a job application if they smoke. And my main 3 points are this. My main point number one is the rising cost of healthcare. Healthcare is always on the rise, and it costs more for smokers than healthcare, and it is killing our businesses. Number 2, productivity. Studies have shown that productivity is down, absenteeism is high for smokers than for non-smokers. And then my main point, number 3. Number 3 is that non-smokers are still being exposed to secondhand smoke in the workplace. So, let's look at my call to action. My call to action is this. Write your Congress, urging a petition to allow employers to discriminate against smokers by asking them beforehand on a job application or in a job interview if they smoke. It is our right as consumers to be able to work in a place that we're not being exposed to secondhand smoke. And it is also our right to be able to shop or to eat at establishments that are completely smoke-free. And with that, I thank you.